There you are, just trying to get through your day. You've got meetings, school pickup, the gym, and all that time your vulva feels like it's on fire. You're not alone, and you don't have to just put up with it, because vulval itching and soreness are common, and they're often misdiagnosed, even though they're usually treatable once we actually understand what is going on. So, I am Dr. Brooke. I'm an obstetrics and gynecology doctor, and in this video we're going to look at some of the commonest reasons for vulval itch and soreness, some of the simple changes that you can make in order to calm the skin down, when you should get checked, and how you can break the itch-scratch cycle so that things actually heal. So let's start with a quick definition. Now, the vulva is the external skin that you can see on the outside. It's made up of the labia, the clitoris, and the skin around the entrance to the vagina. The vagina itself is the internal canal, and most of the itching that people notice is on the vulval skin. That's why skin irritation and dermatology issues go hand in hand. They often cause the vulval itching rather than having an internal infection, for example. I want to also park another myth at this point. Having an itchy vulva does not automatically mean that you've got an STI or thrush. Infections can play a role for some, but everyday irritants and skin conditions are far more common. And repeatedly using over-the-counter treatments to treat, for example, thrush without having a confirmed diagnosis can worsen the problem, because they can have irritants within the treatment, so you're worsening the irritation and you're not actually treating the underlying problem. So why does your vulva get so irritated? Well, the skin of the vulva is thin, it's folded over, and it's warm. So you've got sweat, friction with movement, clothing, periods, sex. You might be using some fragrance washes or wipes, and they all disrupt the skin barrier. And once the skin barrier is irritated or broken, the nerves in the area become extra sensitive. So small triggers then feel like a big itch, and then scratching brings some relief, and that triggers off more inflammation. That's the itch-scratch loop that we're going to come back to. So let's start with the commonest cause of vulval itch, or something called vulvovaginitis. Contact irritation is often the starting point. You might be using fragrance shower gels, body washes, even scented period products or intimate wipes, and they can all cause some tingling or stinging that you notice at the time, and then they irritate the skin barrier, which can slightly break down. And similarly, if you're doing hair removal, like frequent shaving, can cause this little micro trauma, can cause breaks in that skin, and these things then later cause some soreness. Then other important causes of that vulval soreness or itching is thrush. Thrush gives you a classic picture, usually of an intense itching alongside a thick white discharge, although some people can notice just the itch without the discharge. Now, treatments for thrush work well when it is actually thrush, but if it keeps bouncing back, you should see your doctor to get tested that the symptoms you're getting are actually thrush, and that the thrush itself is sensitive to the treatments that you're using, rather than just continuously repeating treatments at home. Then there's bacterial vaginosis, which usually causes a fishy odour to the discharge, potentially a change in the appearance of the discharge, and it can cause some discomfort, but usually not itch itself. There are STIs like chlamydia, gonorrhea, and trichomonas that cause a change in your discharge, maybe a smell, and potentially soreness of the vulva. Herpes also causes painful ulcers, but then there's pubic lice or scabies, a bit less common, and they can cause marked itching, which is often worse at night. So if you've had a new partner recently, or you've had some unprotected sex and you've got these new types of symptoms, a sexual health screen is usually a good idea. Now, I want to mention hormones because they're really important. Having a low level of estrogen, which is common either after birth or in the perimenopause and menopause, can actually lead to changes in the vulval tissues. It can cause the vulval tissues to be thin and dry, and that can cause burning or itching or splitting of the skin. Therefore, using vaginal estrogen creams can replace the estrogen that's missing and improve those symptoms. It's different from taking systemic HRT because it's just like a tablet or a pessary that's put in the vagina, and it's generally well tolerated. So if you think you've got low estrogen, talk to your doctor about that. Another common cause is ingrown hairs or folliculitis. So you can get some small, tender, itchy bumps that can crop up after you've been shaving or waxing the pubic hair in the region. So if you let that hair grow a little longer, or you trim it instead of shaving, or you space out your hair removal, or you don't remove it at all, can all help if your itching is caused by folliculitis. Now then, moving on, there are some skin conditions that can mimic infections. So there are dermatitis or eczema of the vulval skin, and they are very common and often missed. In those cases, the skin of the vulva can look dry, it might be reddened, it might be shiny or scaly, and it can feel sore as well as itchy. So we start by repairing the skin barrier itself by using plain emollients and then, if needed, short courses of steroids. Now that's best done under some guidance of your doctor to help settle things down. There are other skin conditions that are common, like psoriasis or lichen planus, and again they need specialist treatment. If you are suffering with intense vulval or vaginal itching, or you notice some pale, white, thin-looking patches on the vulva alongside that itch and skin that tears easily, you might have a condition called lichen sclerosus. Now, lichen sclerosus is a chronic inflammatory skin condition that can affect the vulva, and it causes persistent itching or burning or splitting of the skin, which can happen after sex. And over time you can get scarring there, and that can change the shape and the appearance of the vulva itself, because the labia can actually look as if they're being absorbed. With this condition, not only does it have a big impact on people's lives, but there is a small increase in the lifetime risk of vulval cancer. And that's why if you're struggling with vulval itching, you shouldn't just ignore it, you should get seen, because we want to diagnose it earlier. So if you think you could have lichen sclerosus, book a GP appointment and say that you're worried about this condition. Typical treatments just begin with some topical steroids that we apply to the area, plus a daily emollient. And if we use these things correctly, it can be life-changing, because that lichen sclerosus itch is like nothing else. If you have pain that's severe, or there's bleeding alongside it, or you get new ulcers in the skin, then you should definitely go back sooner to your GP and talk about it more. If you are always itching your vulva, the itch-scratch cycle is really important to understand, because it explains why your symptoms can snowball, and by breaking that cycle, we can treat your itching and make it better. So what does this mean? Well, you start off by having irritated vulval skin that can be caused by an infection like thrush, for example. So you get an itch signal that makes you scratch. Scratching briefly overrides the itch and it feels good for a moment. But by scratching, it causes micro tears in the skin that releases inflammatory chemicals in the skin. That inflammation then sensitizes your nerve endings, so the itch returns sooner and stronger. So you scratch again, damage the skin barrier further, and that loop continues. Itching can often feel worse at night because there are fewer distractions and the area of the vulva is warmer because you're under your bedding, and histamine levels naturally rise in the evening. Many people also find that they scratch their vulva in their sleep without even realizing it, so that causes them to wake up and have disturbed sleep. So to break this cycle, we start by removing the triggers, of course. You've got to work out why you're having that itch in the first place. So I recommend using plain emollients as a soap substitute, so cutting out any fragrance product. Also changing out of any sweaty gym kit as soon as you're done. Avoiding tight or rubbing clothing. And then if you think you've got thrush, for example, don't keep treating yourself at home. Get it confirmed with swabs by your doctor. And then you can protect the barrier of the vulval skin by applying ointments or emollient creams in the evening and after you've washed. And you can reduce the damage that you get from unconscious scratching by potentially even wearing cotton gloves at night or cutting your nails really short. And if you're really struggling with that intense urge to itch, you can use cool compresses on it for 60 seconds at a time when the urge is peaking. If your doctor tells you you have a dermatitis or lichen sclerosus, then they'll usually give you a plan that might involve topical steroids. And ultimately, you do want to get it treated. Now, if despite doing all of these, your itch still persists after you've tried for 2 weeks of kind of improving your care of the vulval skin, or if you've got pain, splitting of the skin, bleeding, or white patches, definitely see your doctor, because they might need to look for another cause. So vulval itching is miserable, but there is usually a reason why you have it, and there's almost always a way forward. Start with improving the gentle skincare, removing any of the common irritants, and giving the barrier of the skin time to recover. If your symptoms are persisting or you notice changes in the appearance of the skin itself, definitely get checked. And with the right diagnosis and a simple plan, most people feel much more comfortable. So let me know if you have any tips for managing vulval itch or soreness.